can you just like kind of stick your foot in like real quickly and, okay, let's picture a shoe being brand new and a little tight. Are you going to be able to just like quickly stick your foot in and have it on? Or do you have to like wiggle it and make it, you know, kind of, you know, think about that. And to get a shoe on that's a little bit tight and like not really breaking in, you're going to have to wiggle, right? It's kind of the same way with a mom that's in labor, especially at first time. The baby has never, your body has never done this before. And the birth canal has not been used before as the baby is coming down. So the best thing for you moms to do is to be moving around and, you know, doing, swaying back and forth, then squatting, get your hips moving, that kind of stuff, so the baby can like wiggle its way down through. So that's why we don't encourage at all to stay in bed. In the hospitals, sometimes they'll want to, especially if they're going to want to monitor you all the time, have you hooked up, they kind of want you to stay in bed, stay in place. Not a good idea, because we're going to want this baby to move down. So it's really important to be up and around and moving. And so some of the things, something that's really, you know, I would really recommend is making sure that they know ahead of time that you don't want to be fully monitored. They can use a Doppler and come check the baby with a Doppler, something that's not hooked up. But you want to be free to move around and maneuver as you can. Walk the hallways, go outside, whatever you want to do. So try to stay as free as possible. In the worst case scenario, and they really have to have you hooked up, we can always just kind of move you around the bed, like, and, you know, pull the IV thing with you and stuff, and just kind of, you know, be moving. But you're going to want to move, so you want to stay free. And again, the cervical changes, and we're going to be talking about the effacement. And again, we talked about last week about the cervix starting out looking like this at 1 centimeter. When they check you and they say, okay, you're dilated like 1 centimeter, which they might, you know, maybe at your, right around your due date, you go have a checkup. They'll say, do you want me to do a dilation check? You can choose not to, or you can choose to. The less checking, the better, just because it's, again, kind of interfering with the whole process. But most times we're curious and we want to kind of know what's going on, so it's okay. And they might check you and say, okay, you're like 1 centimeter dilated. You'll know that your cervix is open, about like this. And it goes, you know, the 2, as they keep, you know, they check you, and on all the way up till 10. When your cervix is like this, is when they can say, when they'll say, okay, go ahead, you can push whatever you have the urge, whatever you feel like pushing, it's safe. Before that, like you might have pushing sensations, but we're going to ask you not to push, just because we do want a full dilation. Sometimes if you push too early, things will swell, and things just kind of close up a little more. So we do want to wait till we're fully dilated, and so that's when they talk about dilation, that's what they're talking about the cervix opening up and letting the baby come down through. Effacement, and I think this is where we take notes again. Effacement takes place before dilation occurs. What is effacement? Effacement is a softening and thinning out of the cervix. I think we had talked about this the last time. That was the part. Anyway, we'll have to, yeah. It's the softening and thinning of the cervix. Like it starts out, oh yeah, we did talk about that. Like it starts out like 2 to 3 centimeters, like long, and as it effaces, it gets shorter and shorter and shorter until it's like all melted away, and that's the effacement. Number 2, there's measured in percentages from 0% to 100%. So if they do a cervix check, they say you're dilated 2 and like 80% effaced. You know that you're going to want to go to 100%. And so that's the effacement. The effacement will happen before you're fully dilated. cervix is normally 3 to 4 centimeters long, and it faces to paper thin. Okay, it was 3 to 4 centimeters long, and it faces to paper thin. B, there is dilation. What is dilation? The opening up of the cervix, measured in centimeters from 0 centimeter to 10 centimeters. Okay, now we're going to talk about pain management. What associates? Okay, I'm sorry. I thought that this was camp, like writing things down, but it's not. What associations do you have with the word pain? Okay, when we think about pain, usually we think about, okay, there's something wrong, or we think about something that needs to be treated or fixed, and that it is bad, or it should be removed. When we're talking about labor pain, which I don't really like to call it pain because it really doesn't have to be painful, but I mean, but we'll talk about pain. That is not a pain that it's a different kind of pain. It's not one that your mind says, oh, I need to fix this, or there's something wrong. This is actually a pain that we embrace, and that we just learn how to work through, how to stay relaxed and not try to make it go away, because the more it like hurts, the more progress you're making. So it's not something that we're going to try to fix, and we need to have a mindset that we're going to embrace this kind. It's a different kind. Okay, let's say what happens. And again, I think we talked about this last week about the fear, tension, pain cycle. And I kind of relate to in this part, like when you're in labor, and say how does your body react if you see, okay, say you're in a car and you see that there's going to be an accident. If there's a person that sees that an accident is going to happen, or if there's one that's sleeping, which one usually gets hurt? The one that's sleeping, or the one that sees it's going to happen?
The one that sees it.
The one that sees it. Why?
They're tense.
They're tense. So the ones that are sleeping most times don't get hurt, because why? They're limp, and they're relaxed. It's the same way with labor. If you feel a contraction coming and you brace against it, you know what? The pain's going to be more. You're going to feel it more. Rather than if you just stay relaxed, it won't have that. You won't have that cycle of fear, pain, fear. So again, learning to relax through what our mind says is painful. There's actually labor. If you're in labor for 24 hours, you really just have labor pains as much as 3 to 3.5 hours. All the rest of the time, like say this is a 24-hour span of laboring, you really will just be experiencing pain for 3 or 3.5 hours, because all the other times, because pain is intermittent, it's not all the time. Other times you're actually relaxing, or your body is, is recuperating and all that kind of stuff. So if you really think about that, you really aren't experiencing that long pain. It'll be easier to manage, to just work through that. Pain is with the P stands for purposeful and productive. This is the kind of pain that actually produces something. And the A in pain is anticipated. You know it's going to happen. It's different than when you slam your finger in a door. You didn't expect that to happen. It's like, oh my word! Like, I mean, it hurts so bad. And the hurt goes on and on and on. You weren't expecting it, so there was no way that you could actually prepare for it. You can prepare for labor pain. You know it's going to happen, so you can prepare yourself for it. And then again, a pain is not. It doesn't go on and on and on. It's intermittent. It will give you breaks, and it does. It's not constant. And so that's a cool thing about labor. You have it. One that maybe lasts a minute and then it goes away, and you can just totally relax. And the end is for normal. It really is a normal thing. So it's not anything to fear. Okay, I'm just going to read something here from that Dr. Dr. Dick Reed is somebody that wrote a book, and he has a theory that pain is largely due to fear and stress. When experiencing fear and stress, our bodies release a hormone called adrenaline, the body's normal response to this type of situation, sending blood and oxygen to brain and large muscles of body, which are called the flight or fight hormones. And we don't want to encourage the fight or flight hormones, because then you have the fear, tension, the fear, pain cycle, because your body is either trying to fight against it or it wants to just flee from it. Like if you're in a bad situation, what do you sometimes want to do? You just want to like run away from it, right? This is not something that we want to run away from. We want to embrace it and even become brave and explore what's going on in your body. So, okay, we're going to take some time now to dim the lights, turn some music on, and we're going to get into a relaxed state. Again, a practice for relaxation. And I'm going to be reading a relaxation script as you guys you can find a comfortable place with your pillows to lay down. I have a pile of blankets back here. Just get as comfortable as possible. And I'm going to be dimming the lights and turning music on and then reading a script. And I want you to explore to see what your body feels like when it gets into a really relaxed state. And these are things that we're going to practice. And I want you guys to practice them at home 2 or 3 times a week. Just set aside time to practice relaxation. I cannot stress that enough. It is so important to learn how to relax. Because again, that is what you're going to be doing during labor, is relaxing. That's what you need to do too. How the baby come is relaxing. It sounds really easy and fun, right? All I have to do is relax. So we're going to practice relaxing.